Introduction. Welcome to this in-depth exploration of the placebo response in canine epilepsy trials. The placebo response is a phenomenon observed in both human and veterinary medicine, where a beneficial health response is seen following the administration of substances without medical efficacy. In this context, the term placebo response refers to an improvement initiated by the administered compound, observed within the placebo group, independent of the underlying cause. Understanding the placebo response is crucial, especially in the field of canine epilepsy, as it can significantly influence the evaluation of new treatments. This study aims to shed light on the magnitude and variability of the placebo response in canine epilepsy trials, particularly those conducted using a prospective crossover design. Background. The placebo response is believed to be triggered by various psychological and neurobiological factors, including expectations, conditioning, character traits, neurotransmitters such as dopamine, oxytocin, serotonin, norepinephrine, and endogenous opioid neuropeptides, as well as hormones like peptide cholecystokinin, immune responses, and genetics. In animals, similar mechanisms are assumed to be at play, such as conditioning-induced expectancy and ancillary mechanisms caused by human contact and care. In veterinary medicine, the placebo response has been reported across different species and conditions. Studies have shown that treatment success evaluations, often influenced by investigator-defined outcome measures, introduce inevitable biases. Clinical improvements in placebo groups tend to differ between owners and veterinarians, primarily due to the subjective nature of the assessments. In the context of canine epilepsy, the placebo response has been previously documented using data from 3 clinical trials. These trials revealed a seizure reduction compared to baseline in the placebo groups, with 29% showing a reduction of more than 50%, thereby classified as treatment responders. However, the reasons behind these positive responses in the placebo groups were not thoroughly analyzed. The placebo response can significantly impact the assessment of treatment efficacy, affecting both inactive and active treatments. This necessitates the use of placebo-controlled, double-blinded study designs to assess the effectiveness of novel treatments accurately. Standardized objective outcome parameters should be employed to reduce bias and ensure the superiority of interventions over inert treatments. Study objective. The primary objective of this study is to evaluate whether the placebo response is diminished in canine epilepsy trials, conducted using a prospective crossover design. Understanding the magnitude of the placebo response across different trial designs is essential for accurately assessing treatment efficacy and improving future trial designs. Materials and methods. Data from 3 former epilepsy trials at international study sites were assessed in this multi-center study. One of these studies is yet to be published, but the placebo data are reported here. The clinical trials evaluated the efficacy of dietary modifications on the seizure symptomology of canine idiopathic epilepsy in privately owned dogs. The trials were approved by the local Ethics and Welfare Group, the Clinical Research Ethical Review Board, and the Lower Saxony State Office for Consumer Protection and Food Safety in Germany. The more recent studies adhered to the Animal Research, Reporting of In Vivo Experiments Arrive guidelines, where applicable. All trials were designed as prospective, randomized, double-blinded, placebo-controlled crossover studies, offering a comparable placebo arm with the same patients. Identical inclusion criteria were applied at all sites, with all dogs having unremarkable magnetic resonance imaging of the brain and meeting the Tier 2 confidence level of the International Veterinary Epilepsy Task Force, IVETF, for diagnosing idiopathic epilepsy. 2 modifications to the IVETF criteria were applied. The maximum age at seizure onset was increased to 12 years, and abnormalities in the interictal physical and neurological examination caused by anti-seizure medication were tolerated. Patients received at least 1 long-term anti-seizure medication, ASM, in a steady state and had experienced at least 3 generalized epileptic seizures under their current medication in the past 3 months prior to study participation. The first study tested a medium-chain triglyceride MCT-enriched diet, the second one a MCT dietary supplement, and the latest unpublished study assessed a probiotic supplement as dietary intervention. Each dog received the randomized allocated diet or dietary supplement, intervention versus matching placebo, for 3 months alongside their current therapeutic treatment, followed by a switch to the respective other diet or dietary supplement. Crossover administered for another 3 months. No changes to the current long-term ASM were allowed, but voluntary withdrawal from the study was possible at any time. In the unpublished study, a dose adjustment of the current ASM after serum concentration assessment was allowed. The introduction of the new long-term add-on ASM resulted in exclusion from all 3 studies. Evaluation of the seizure symptomology was based on daily owner reports, documented in standardized seizure diaries. Additionally, individual seizure reports logged by owners for 3 months prior to study participation were assessed as baseline data. The seizure diaries and reports were used to determine seizure frequency and differentiate seizure types, according to the IVETF consensus report definitions. For statistical analysis, only convulsive seizures were considered. Estimating the seizure frequency, the number of seizures per month was calculated for the baseline period prior to study entry and for the placebo phase during the trial, with an additional distinction between the placebo administration in the first and second study phases. Results. The study included 60 dogs, former participants of 3 previous dietary epilepsy trials. The study population consisted of 37 males neutered, N equals 25, intact, N equals 12, and 23 females neutered, N equals 15, intact, N equals 8. The mean age was 4.8 years, and the mean weight was 28.43 kg at the first visit of the trial. 35 different breeds were included, with border collies and beagles being the most common, along with 12 crossbreed dogs. All dogs were chronically treated with at least one ASM, with 95% receiving phenobarbital and 65% treated with potassium bromide. The overall monthly seizure frequency significantly increased during placebo administration compared to the baseline. The baseline seizure frequency had a mean of 2.30 seizures per month and increased to 2.95 seizures per month during placebo treatment. Differentiating the placebo treatment by study phase revealed a significant phase effect, with the monthly seizure frequency significantly increasing in the second study phase compared to the baseline. However, no significant difference from baseline was observed for dogs receiving the placebo in the first study phase. When comparing the relative change in seizure frequency from the two different placebo phases to the baseline, the second phase had a significant increase compared to the first one, highlighting a potential honeymoon effect at the beginning of the trial. 7 of the 33 dogs receiving placebo in the first study phase had more than a 50% reduction in seizure frequency, with one becoming seizure-free, in contrast to only one dog out of 27 receiving placebo in the second study phase, showing more than a 50% reduction. Discussion. The placebo response is a well-recognized phenomenon in veterinary medicine and has been described in canine epilepsy, where patients responded to placebo treatments with a decrease in seizure frequency of around 30%. However, in the 3 recent dietary placebo-controlled, double-blinded, crossover canine epilepsy trials, such a strong placebo response was not observed. It was hypothesized that the placebo response is diminished in canine epilepsy trials conducted in a prospective crossover design. Statistical analysis revealed no placebo response that improved monthly seizure frequency in the conducted trials. Instead, the monthly seizure frequency of placebo-treated patients increased during the second study phase compared to the baseline, and to the placebo-treated patients in the first study phase. However, 21% of placebo-treated dogs were classified as partial responders in the first study phase, whereas 4% were considered partial responders in the second study phase. These findings highlight a potential honeymoon effect that is already known from ASM treatment in humans and dogs and which, according to our analyzed studies, can also occur with placebo treatment. The phase effect observed in the study may be attributed to various factors. One possible explanation is the honeymoon effect, where a new treatment's introduction, whether it's an active treatment or a placebo, might temporarily improve the patient's condition due to increased attention and care from the owners and veterinarians. This effect tends to diminish over time, as seen in the second study phase, where the placebo response was significantly lower. Another factor could be the adaptation or habituation of the dogs to the study conditions. As the trial progresses, the novelty of the treatment wears off, and the dogs might revert to their baseline seizure frequencies. This phenomenon has been noted in human epilepsy trials and might similarly influence canine trials. The importance of considering the placebo response and its variability cannot be overstated. For future clinical trials in canine epilepsy, it is crucial to design studies that account for these effects. Employing a prospective crossover design might help in understanding the true efficacy of new treatments by mitigating the impact of placebo responses. Additionally, objective outcome measures, such as seizure frequency logs maintained by owners, should be complemented with other assessment tools to provide a more comprehensive evaluation of treatment efficacy. The findings also suggest that owner expectations and perceptions play a significant role in reporting outcomes. Training and educating owners about the potential for placebo effects and the importance of consistent reporting can help reduce biases and improve the accuracy of trial results. Conclusion. In summary, this study highlights the complex nature of the placebo response in canine epilepsy trials. The diminished placebo response observed in the prospective crossover design trials suggests that this design might be more effective in assessing the true efficacy of new treatments. The phase effect and the potential for a honeymoon period underline the necessity of careful study design and analysis to account for these variables. Future research should focus on refining trial designs to minimize the impact of placebo responses and improve the reliability of efficacy assessments. This might include longer baseline periods, more robust training for owners, and the use of additional objective measures alongside seizure frequency logs. Understanding and mitigating the placebo response will ultimately lead to more accurate and reliable evaluations of new treatments, benefiting both canine patients and their owners.